Hey guys, so today I wanted to talk about a patient that I met a couple of weeks ago with quite an interesting story. So picture this, a woman born in 1988, so that would have made her either 26 or 27. So she follows me into the room, she sits down and goes, I need to get my testosterone checked. So of course you'll end up asking, why do you want a testosterone test? The reason for this was that she noticed some physical changes about her. She's been having a lot more acne the last couple of years. She noticed a bit more body hair too, especially between her belly button and her pelvis, which is a very usual place where men grow hair. And she noticed that she had a bigger set of labia. Okay, fair enough that she has some reason to worry, but how often do women of her age actually have a newfound high level of testosterone? Almost never. So of course I wanted to get to the bottom of this. Why is it exactly that you need your testosterone tested? Are you worried that you might be having some kind of disease, or what's going on? She said that she really wanted to find out what all those bodily complaints were coming from, and then just in the middle she kind of let slip that she also might be having some male feelings. I don't know about you, but when someone tells me they're having male feelings, I don't care if they're a male or a female, I have no idea what that means. So I asked her to elaborate. Ever since she was a teenager, she has never really completely felt like a girl. She was always kind of in the middle, she felt, and especially when being in love or fantasizing or having sex, she really likes to feel in control and basically like a man. So it's been going on for a long time, I asked her, these male feelings as you describe it. Yes, that's true, she said, and when she was 14 she even experimented a little bit with a binder. Okay, fair enough, so how did that go? And then she stopped wearing the binder because her family and friends weren't really feeling it. So she went on for years like this, and she went to the gynecologist a couple of times because of the menstruation problem. So they did a couple of ultrasounds and they didn't find anything wrong with the uterus or her ovaries, so physically speaking, she was a fully functional female. So what is it now? What is the goal that you're trying to reach here? She had just gotten a new girlfriend, and she really noticed it taking a toll on her relationship. I mean, her girlfriend was looking for another girlfriend in the relationship, so she felt really guilty that she couldn't completely be a woman for her partner. So she thought, if my testosterone is a little bit too high, and if we lower it, that way I can finally be who I'm supposed to be, especially for my girlfriend. So I asked, do you feel like you've had a lot of opportunity in your life to explore your gender identity? And I threw her for a loop. So I explained to her there are different kinds of gender identities. You can identify as one sex or two sexes or maybe none of them at all. So that's a lot of stuff that you need to work out for yourself, if you feel like you're different than the sex that was assigned to you by birth. That was new for her. I noticed that from the beginning. And so in the end, this whole concept with her wasn't about the testosterone. It was definitely about what she thought the testosterone was doing to her, and especially what it was doing to her mind and her identity. So we decided to do a blood test on testosterone, and then if the testosterone was within the normal ranges, we would decide what we would do with those male feelings. So I talked about it with the doctor who was guiding me, and I talked about it with fellow students and to another doctor, and none of them would have recognized that hint, that feeling of being like a male. So basically what most people would have done is just do the testosterone test and have her be on her way. And I actually recognized that possible gender dysphoria because I have a friend who's transgender, and I'm on Tumblr quite a lot. But the thing is, I felt like I saw her and her fear and her doubts. But the thing is, I felt like I saw her worries and her fears and her doubts. I got the feeling that I could recognize what she actually came here for. I had the feeling that I could see what she needed help with. And I also knew that a lot of people wouldn't have noticed it with her. It's easier for someone to recognize a depression if they've been depressed themselves, It's easier to talk to an athlete with a sports injury if you're really invested in your own sport as well. It's easy to guide someone's grief if you've lost someone in your life too. So in the end, our life experiences as people would help us make better doctors. I honestly think empathy is the most important ability that you should have as a doctor, and it really gets you a long way. I mean, any doctor can prescribe you medicine. That's a big part of our job too, but it kind of felt nice to feel that I was actually listening to a patient. I was actually listening to a person.